The first step in doing it tonight, when I'm going to want you to start the process, is to use your fingertips. Your fingertips are remarkably sensitive. Think about how a blind person reads Braille. They're feeling little dots on a page, and a little change of that dot changes a word. So obviously, the brain has the ability to create these mental images, but it takes time and it takes concentration. Start with the concept of a 1-inch circle. So you, for instance, here, you take a 1-inch circle, and you want to vary the pressure, and you want to maximize the normal breast texture. And we want to cover everything from your collarbone to your bra line, the middle, way out into the armpit. Now the armpit could be actually best examined sitting with your arm relaxed, but we'll also show you how to do it lying. So that's the area. It takes time, and tonight is a perfect time to start. Why tonight? Because you know your exam is normal. You'll set aside some time, you'll relax, and one thing I want you to not do is look for lumps or try to analyze. I want you to visualize, not analyze. If you start looking for lumps, you'll feel this texture and it'll make you apprehensive. But if you use the word normal and you reinforce normal and you're relaxed, you will be able to get that mental image of the normal. It may take several nights, but you'll reach a point where you say, you know what, it feels exactly the same tonight as last night. Bingo, you got it. Then you do it once a month. And I'm going to show you how to mark the calendar. We'll have a program with where we circle day 1 of every month. And when you do the exam, you put an X through it. This gives you a permanent record. It kind of creates a little confidence that you're doing it right, and it gives you a feeling of confidence that you've got your health under control. So this is a great program for you. Now in menstruating women, we ask them to do it 5 to 10 days after the onset of their menstrual period. So we adjust the calendar slightly different. They put the X through the day that the period started, and then they kind of bracket out 5 to 10 days, and when they do the exam, then they put the X for the day they did the exam. That gives these women a permanent example also. So I think the next step is to have you put on the gown, and then I'm going to show you just exactly how I want you to do it tonight. What you want to do is look straight at the mirror and look at your entire breast, and focus also on the nipples, because that's sometimes where we see the earliest changes. Two of the things that we really like to think about in terms of catching cancers early is nipple discharge, where it comes out spontaneously, particularly if it's clear or if it's bloody. And secondly, if we get ulcerations or irritations in the surface of the nipple. That's a condition called Paget's disease, and that's very curable if caught early. So now let's do this. Let's give you a chance to let me see what you've learned and see how you do it. Is that okay?
Sure.
Let's try it. So let's actually put it on your shoulder and have you kind of roll up a little bit. We want to stretch the breast, remember. We want to get the breast thinned out, so if something's hiding in there, there's no room to hide. So let's see the 1-inch circle. Okay, that's really pretty good, but just try to relax in here. Think of pressing straight down using all 3 fingers. You'd be surprised how many people look like they're playing the piano. They run their fingers over it. That may be okay for certain things, but it just doesn't work for the breast. So relax just a little more. That's it. Straight down, and then try to visualize the tissue between your skin and your chest wall. Remind yourself that it's normal. There are no lumps. This is the normal texture. So I want you to visualize, not analyze. At first, it's a challenge, but as you concentrate and relax and let the images flow into your brain, just like the blind person who's learned Braille, you will get that mental image. You can be confident of that. And you make the 1-inch circle. Does that make sense to you?
Yes.
Okay. The goal is for you to evaluate the entire breast twice. So these overlapping circles allow you to do it. Now, one of the easiest ways to think about it is when you mow the lawn. You don't want to miss a blade of grass, so you go down, move over, and go up the lawn. Some people do the breast exam in the same way because that's a helpful way of thinking about it. So in the vertical strip method, you'd have overlapping circles, and you go from the top down to the bottom of the breast, come over a 1/2 inch, and then go up again, and then over and repeat the process. For most women, they seem to do better on the outer part of the breast, going from the outside in. If that seems to you to be more comfortable, then that's the way to do it. Just the key is to examine all of the breast twice, from the collarbone to the bra line, the middle to the armpit, with overlapping circles.
Okay.